I'm going to demonstrate the supine hip flexor stretch. How you want to position the patient on the table is you want the top, like where the tops of their jean pockets go at the table's edge. The affected leg stays down and they grab the opposite leg and lean back and drop that leg to the ground. And they do this 10 times for 10 seconds. These are called step downs. So you'll have the patient start on the step. You can change the level just to change the difficulty. And then they'll stand on the affected leg and bring the other leg down, touching just their heel to the ground and coming back up. And they'll do 3 sets of 15. While you're having the patient do this, you want to make sure that their knee is not moving side to side and also that they're not popping their hip. You just want them to go nice and controlled up and down. Alright, these are called lateral step ups. So you have the patient standing on the side of the step up, and then they'll just go up and then back down, 3 sets of 15. And with this exercise, you'll want them to step up with the affected leg, just to practice that motion. Alright, these are lunges, and so there's 2 ways that we can have them do it, just the normal going forward into a lunge and then back up, and then there's also to this side and back up, and they'll do 3 sets of 15.
This exercise is a 3-way lunge. So the 3 directions are forward, side, and back. So they're just gonna lunge forward, put their affected leg to the side, and then back. We'll do that 3 sets of 15.
Go.
This exercise is a reverse lunge. So you're gonna give them the little slidey board and place it on the ground in front of them. You want them balancing on their affected leg. So they're gonna be lunging back with their good leg, and they'll just go back like that. They don't have to go super deep, especially if they're a newer patient, so they can kind of stop here. We'll do that 3 sets of 15. This exercise is called the Nordic hamstring curl with the ball. So you're gonna wanna get them the exercise ball, a foam pad to kneel on, and have them by a table that they can hook their feet under. And they're gonna extend out into a plank position as far as they can, and then use their hamstrings to pull themselves back up. You wanna make sure that their bum stays tucked in line with their hips and torso.
Alright, this exercise is called universal AAROM, and it's just to kind of help patients get range of motion back in their lower extremities. So what you'll have them do is you'll have them scoot their chair pretty far forward on this machine, and then you'll have them use their unaffected leg to push it all the way out, and then they'll bring their other leg up, and then they just let the weight of the machine push their knees into a bend until they feel a stretch, and they'll hold it for about 10 to 15 seconds, and then they can go out to get a break, and they'll just keep doing this for 5 to 10 minutes. It should be marked on the chart how long the therapist wants them to do it. And when they're pushing the machine back out, they're only using their unaffected leg so they don't injure anything. This is purely for range of motion. It's not a strengthening exercise. We'll usually have patients move to this machine when they've kind of maxed out the genu bender and they're not feeling as much of a stretch. Alright, this is called bike AAROM, and it's another one that we'll use to help with range of motion, the legs. So you'll have the patient bring the chair on the bike pretty far forward so that when they're pedaling, they can't go all the way around completely. You just want them to kind of use their unaffected leg to push this one around until they feel a stretch. They'll hold it for about 10 to 15 seconds, and then they'll go back out and just kind of rock back and forth, trying to get range of motion into the knee. If the patient is able to go all the way around without getting a stretch, you can have them just move the chair on the bike further forward. And if they're all the way forward and still getting it, you might want to have them progress from this exercise to a different one. Okay.
Go.
Okay, this exercise is called the 3-way lunges. I think I held up 2 fingers.